Hi, it's Andrew here from Shelley and Pope Dental Practice. Welcome to this video which is about broken dentures. So why do dentures break? Well, several reasons. One is you could just drop them. Another one is that they have a thin bit of acrylic somewhere. Sometimes that's unavoidable and that can break. Or if you've got opposing lower natural teeth, for example, on a top one, that can make them break. The most common thing though is because in the middle here the palate is hard, the gum around here is softer. Now that's fine when the dentures are still fitted, but as gums shrink back, which they do throughout life, then you can find the denture then starts to flex as you chew on it, and it's that repeated flexure, bending of the dentures that can cause fractures, which is why you quite often see them fractured kind of right down the middle here. So that can happen. So a couple of things we can do to prevent fractures. One is when you're cleaning them, if you drop them in the sink, that quite often breaks dentures, so be careful about that. What you could do is fill your sink up with water, so when you're cleaning your dentures it cushions the fall of your dentures. The other thing is keep them away from dogs. Dogs love dentures for some reason. They must like something about the smell of dentures, so quite often we get people coming in the practice saying, oh, I left my denture out and my dog had it, so yeah, keep it away from your dog as well. So what would normally happen is you come in the practice, sometimes we need an impression, sometimes we don't. We'd send your denture off to a technician, have it back the next day, or you could go directly to a clinical dental technician who will be able to do that for you. Some of those are still open, by the way. You may be able to get your denture fixed in an emergency if you can find a clinical dental technician which is still open. Of course, be careful because you still have to bear in mind the social distancing measures that we have in place at the moment. When can you fix it yourself though? Well, if the two pieces locate together, so you've got a piece here and a piece there, and there's one place they can go back in together again, they don't move, you can get them nice and firmly together, then you could try super gluing them. Just keep your denture, the broken parts of the denture, really clean and dry. A very small amount of super glue. Try not to get it all over your fingers because that's what happens when I try and do it sometimes. And then hold the pieces together. Have a practice first to make sure that the pieces are going to go back together in the way that you want them to. And then apply your glue and hold them together for only about 10 seconds. That should be fine. Of course, be careful after that because it remains a point of weakness after that has been repaired. Sharp edges. If say a part is broken off the back here, sometimes happens, then you might want to just smooth it over. You could use a nail file for that, or a little emery board, or your Dremel, but be careful. You might want to use denture fixative after that, because a part breaking off might make them a bit looser, but we've got denture fixatives. You can get those from the chemist in the supermarket. I dare say you can get them online from the supermarkets at the moment as well. So, I hope you find that useful. Keep it away from your dog. We look forward to seeing you back at the practice for some professional dentistry in due course. Bear in mind this is just an emergency measure. If you've got any ideas for future videos or self-help for home dentistry while the COVID crisis is going on, then just give us a message below and we'll see what we can do. In the meantime, keep healthy, stay well, look after yourselves, and thanks for listening.